Morning. It's the way Singapore wakes up. Wake up, Glenn, Angel, and the Flying Dutchman. Wake up in the morning feeling like Kiss 92's Big Show.
Good morning, Singapore. It's The Big Show, and The Big Show TV is on right now with award-winning psychologist from the therapy room, Dr. Geraldine Tan. Good morning, Jerry.
Good morning. I still can see you chewing.
Yeah,
we can hear you chewing.
and I'm just so hungry as well. All of us are so hungry. So
hungry.
we were having breakfast earlier on outside.
We clearly are not fed at home.
And then
that's why.
Cheyenne came out and went, 50 seconds! 50 seconds! Everyone come in!
We're like,
So I'm
what?
like, okay, Cheyenne. Yeah, but always so nice to see you in the morning. I would have just given up
Lovely to
breakfast
see all
just to
of
be
you.
with you.
Oh,
I don't think so.
You are right, actually.
Cheyenne just all of you panic.
Good morning, Dr. Jerry. How are you?
There. Exactly the word she just mentioned. Panic.
Like panic attacks?
Today we're talking about panic attacks and anxiety attacks.
Yeah.
We want to find out what
Yes,
the
we
difference
are.
is. What's the difference between a panic attack and an anxiety attack?
Yeah, but before that, we always have a little recap of the previous session. So, Angel, lucky you weren't around and we were doing your topic. Remember
My topic?
the
She said your
decluttering?
Oh, my
Yeah,
topic.
you
My
sent it
topic.
to
Because
me.
I'm a contributor as well, yes. But this, what was the topic? I don't even remember what I sent you.
The article about decluttering, and then we were talking about the ABC of emotional detox.
Ah, okay. I remember.
Getting rid of negativity. Yes. So we she cannot remember.
It's okay, I'm just saying. You know why not? Because that's why the topic was for her. Decluttering her mind. Because there's too much clutter in
I was
there.
doing exactly that in South Africa. Decluttering.
Yes, so welcome back.
Thank you.
So last week, FD had the spotlight because we were looking at, it was a very interesting yearning, yet there was a bit of frustration.
Oh.
And we were going backwards to figure out where the negativity was coming from. So
You
we were
had him
looking
on
at
the couch.
activity.
I was on the
You had
couch.
him on
FD
the
was
couch.
very happy last week.
Oh, yeah? Okay.
He felt he got his money's worth.
The $0 that he paid. Cheapskate.
See, Jerry, they're calling me a cheapskate. Now I'm going to have a panic attack.
Oh,
No.
dear.
All these
Now he's
people
going to
think
go
I'm
home
a
and cry.
Okay. But last week I gave homework, is the 5 core values, our 5 core values. Everybody forgot. So I'm just going to say it at the beginning. And then, so all the listeners would have forgotten also. So think about your 5 core values and we will come back to it at some point in time. But I shall not panic everyone. But you see how we use the word, right? Like we use the word worry, we use the word anxiety, we use the word panic, and it's thrown around so loosely. So I know we did it 2 years ago, but I thought I wanted to revisit this topic again because the words are being used so loosely, especially with the younger generation. They classify everything as a panic attack, which
This is true,
we
yeah.
want to try and figure out, what is just normal worry, because now everybody has an anxiety disorder and no one likes worry anymore. But worry is part of our emotional toolbox. We need worry in there. So I always say that worry is like our alarm bell. It helps us to stay alert. It helps us to see if we're on the right track, if something is going wrong. So worry, it is a concern for something that may happen. So it is normal, it is valid.
Right.
So we don't want to eradicate having to worry.
Okay. All right. Let's continue to talk about this a little bit more on the Big Show TV. Up next, Dollar. This is Classic on Kiss 92. Okay. All right, Jerry. So, but is it okay? I mean, when you know someone is going through a hard time, someone who's overly worried. I'm not even saying reach the anxiety or panic attack stage, but worrying all the time. And then you go, don't you worry about a thing.
Any chance to sing?
Don't you worry about a thing.
Oh my goodness. Okay.
So that you now go from worry to hearing problems.
I've done my homework.
But seriously, is it appropriate to tell the person, okay, don't worry.
No.
Well, that's not helping the situation, is it? You know, because if you tell someone, don't worry, what do you expect them to do? They are still caught in that thought process. So
Exactly. Better just keep quiet.
Just feel dismissed lah.
Can you say let's see how we can solve?
Yeah, I was
this
about
issue?
to say.
You know how we can work together to solve it?
Yeah, we can. So, sometimes there are certain aspects of worry. It really depends, right? If the perhaps the lift alarm is going off, and someone is like, "Oh my God, what happened?" Let's go and find out. Or so you create a little bit of certainty, you create a little bit of control for the person. That sometimes help. We can say, it's so creating certainty. You can say, oh, they're just fixing the lift, or it would go off in a while. You provide a definitive timeline.
Jerry, are we worrying more today because of all these political do's and don'ts that's causing us to overthink everything?
Yeah.
Give her an example.
What do you
Like, for
mean
example,
by-
FD. Yeah, you see, that's why Jerry and myself, we think alike. See, I'm helping you, so Jerry. Never give her an example. So, for example, FD, right? These days, it really pisses him off and just irritates him that he can't kiss everybody, for example. That he comes across.
Because
Just
I'm a touch and feel person.
The Eurasian, the Eurasian hug and the kiss.
It's very frustrating. So I tend to overthink.
So, and if he goes like too close or whatever, then he'll start to worry.
Yes.
Yeah. That's just a mild example, but yeah, that's one of them.
So staying within the boundaries, knowing, so perhaps the clarity of the boundaries is not there, so if you have the clarity of boundary, you would not be as worried, so if someone tells you, don't touch me, you're very clear about that. Okay, I won't touch you. But
that'll be too late already. You know what I mean, Jerry?
Yeah, because
It's
for us,
too
it's
late.
second nature,
You see, Trump is getting sued, I don't know how many years after the fact.
$83 million.
$83 million. Oh my God.
That's pocket change, though. $83 million, man.
But sometimes we don't put in the boundary. Sometimes society don't put in a very clear boundary for us. Sometimes we think that we know, but actually we don't know. So it comes from ourselves that we want to push the boundary a little bit more. Yeah. So the restrictions tend to cause a little bit more worry than normal, which it's supposed to alert us. It's like the car when you go a little bit too close, to the sides or anything, it starts to go beep 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 beep, and the closer you get, it gets louder, right? So it causes you to stay alert that you don't come too close. But
That's a good analogy.
Yeah, sometimes we push the boundaries, right? We try to go until it goes beep and see how near we can touch the wall or the gate or whatever it is.
But it's interesting that you said if you don't draw the boundaries or state what it is, then people don't know how far to push it. You know what I mean? Like we fear what we don't know. You know what I mean?
We
Like
fear
what we don't know.
But that's the whole problem, right? It's because people don't state the boundaries. Then I move in, I
That's
do
exactly
something,
what
and
Dr.
whoa.
Jerry says.
Yeah.
Yeah.
You know, but-
It's not
but
clear.
then-
but
but
it's
I'm
also,
worried-
But it's also you assuming that the boundaries of everybody else is the boundaries of you.
Hence, you worry, right?
You know what I mean? Like we can't assume that everyone has the same sort of mindset and
it's
perception.
it's a confusing world we live
It
in
is.
these
Yeah.
days,
It
Sherry.
is.
You know, on one hand, we don't want to tell people what to do. We don't want to tell people this or
'Cause it's
that.
politically incorrect.
We want to make them just react naturally.
Yeah.
And then, you know, when the person does something and then, you know, other people judge or you know, people get offended.
Yeah.
So it's a very
It's a very sensitive world that we live
that
in
we're
now.
living in right now.
Very,
yeah.
very sensitive. So it's easier for people to have panic attacks and anxiety. Like I get
No,
but I
I
get
think
anxious
so.
as well. No, I don't have attacks, but I get very anxious as well sometimes. You know, for no reason I feel I just get anxious, and I don't know why.
Yeah, so we are living in a very anxiety filled world nowadays. The level of anxiety has come up since after COVID. So during COVID, there was a huge spike, but it never really came down. And I thought it would come down, but there's so many people who are reporting anxiety symptoms for the last 2 years. So yeah, I think it is quite prevalent in many of the students as well as adults who are suffering from anxiety. So when we talk about anxiety, it's not temporary, it's actually very pervasive. So it it's pervasive in different environments for different issues. So if, let's say, if they only had anxiety with people, you know, it could be social anxiety.
This is my new cue, you know, to say we are going on air. Okay, stand by.
Before you go.
Kiss 92 traffic.
On Tuas Road towards Jalan Ahmad Ibrahim, right after the PIE. Avoid the left lane. A vehicle's broken down there. Wherever you are today, stay safe.
Good morning and welcome back to The Big Show and The Big Show TV. It's Glenn, Angel, the God of Fortune, and Dr. Geraldine Tan from the therapy room. Good morning, Jerry, once again.
Where's the Flying Dutchman? You forgot about
I
him.
left the room
No, I
already.
said it's
No,
Glenn,
you didn't.
Angel, the
and-
Flying Dutchman, and
no,
the God of Fortune.
no.
No. You
no.
just left me out. It's
Yeah.
all right.
That
Fine.
means I'm referring to you as the God of
I
Fortune.
no, you wonder why I get anxious and I have worries, Jerry. They just leave me out of the show. No,
Don't say they. I didn't have anything to do with that. It was Glenn.
Okay, anyways, we're talking about panic and anxiety attacks with Dr. Geraldine Tan today.
But yeah, Dr. Jerry, just wanted to ask you, like, when is anxiety, and when is it not pretend anxiety, but maybe an over exaggeration of that emotion?
Wow.
Because as you said, a lot of people say they're getting anxious, they have panic
Yes.
attacks, but they're using it very loosely. So when do we take it seriously?
Correct.
And when is it just, they're being over dramatic?
I see. Okay. So if you are worried and you're able to say that you're worried, it's probably that mild anxiety, you are looking out for it. Any disorder, as we always say, needs to create a dysfunction in your daily functioning, in your social functioning, in your school, in your work. You cannot function in all those different aspects. It's more debilitating than just, oh, I feel scared, I feel worried. So for people that say, oh, I feel very scared, to go on the roller coaster, and then they go on the roller coaster and scream their head off and then feel very happy about it, that is not anxiety. It doesn't stop them. Whereas if one of the teens, and I think I used this example before, he's really, really scared of the balloon for whatever reason, a blown up balloon. So the second he's shown like a deflated balloon, he shivers. He is so jittery. if he is shown a blown up balloon, there was once the lift door opened in a car park. He just turned and ran onto into the car park without looking for traffic at all. Now that is anxiety, and we literally had to desensitize him and work through that whole anxiety for him.
Wow.
You know who we need to
So-
send to you? You know who we need to send to you? Angel's Tofu.
Tofu. Very scared of balloons.
You know, he's not very scared of balloons. My goodness, it was just like, he's fine now.
Okay, Dr. Jerry, I need to ask this question. When I was growing up, I knew people who were scared of balloons. You don't like a balloon, you turn around, you walk away. You know, I knew people who had worries and they were anxious.
Suck it up.
They sucked it up. They did it. Why is that sucking up and just dealing with it and moving on disappeared now? Why does everything seem to need therapy?
Yeah, why did it work
Every
back
time
then,
there's
but-
a problem,
yeah.
it needs therapy.
Everything needs mollycoddling now. You know what I
Okay,
mean?
that's
Everything-
another word for it.
You
Yeah,
know,
you could
everything
use
needs
that.
a very soft touch now. Why is that?
Why is that?
Well, I knew you were going to ask me, and I was pondering about it, right? You know, yeah, you'd love to ask me this question, right? Like, why does everything need therapy? I think this generation is a transition generation. You give them a little bit of awareness, you give them a little bit of knowledge, they overgeneralize. So they start to learn something and they apply it for everything. So it's like a kid learning ABC and then they use it for everything, you know, or use mama and then they call every woman in the world mama, right? So it suddenly becomes something that they need to learn, relearn, and practice. And then that's why we're talking about it today, to learn how to distinguish what is a normal level of worry. And it's okay. What is an abnormal level of worry where we need then receive therapy? Because we all know about pain. So when we first started to know about pain, we go, oh, does every pain warrant a doctor's visit? Then we start to learn that no, there are some pains that I can manage, I can tolerate. Maybe pain is not so great. Fever. So in the past, people didn't know about fever. You know, they just know that they felt uncomfortable. So they didn't know better. They just had to suck it up and move on. But when they start to know about illnesses, then they start to go, okay, you know, I need to go and see a doctor. Then we need to teach them. Not every fever you need to run to the doctor. I think we had a period in Singapore we had to teach people not to keep running to the doctors.
Speaking of fevers, I got a very interesting story about how the fever tree got its name.
All right, we'll talk about that on The Big Show TV. It is 8:18.
Kiss 92 Time Check brought to you by
So you know the fever tree soda, fever tree tonic that you can buy in the glass bottles, and they've got this symbol of a tree, sort of like with no leaves.
Yeah.
It's kind of like a
Is
bare
it the tree of life?
No, it's
No.
called the fever tree.
Oh, I
So
see.
I saw it in South Africa. So I was like, oh, what's that tree? And they're like, it's the fever tree. And then they said the fever tree got its name because when it has leaves and everything, not wanderers, travelers used to sit underneath it to rest under the shade, but they used to get sick.
Oh.
So every time they sat under it, they got sick. And so they used to call it the fever tree. But little did they know was that they were probably getting bitten by mosquitoes. And also when you touch the bark of the tree, it sort of you sort of had this white powder on your hand. So they used to think that the tree was possessed.
Oh, right.
So that's how the fever tree got its name.
Oh, I see.
So it's not actually that the tree gave them a fever. It was probably from an insect bite or something else that they were sitting under.
But still, very negative though. Why did they name that tonic and
The
soda
fever tree tonic.
after okay, that's it. I'm not having that anymore. No, actually, I stopped buying Fever Tree tonic and soda for a long time now. Now
Okay.
I only
Chang.
buy Sing.
Sing. Now I only use Soda Stream.
Some people say,
I
"Oh,
use Soda Stream for my soda.
oh, that's weak."
What do you mean that's weak?
Weak soda.
You can control the bubbles though.
Yeah, but Sing.
You're doing it wrong.
Sing.
You sing.
Some people
Anyway.
say
And
Singer,
they sing
but
no
Sing.
in
Okay.
Thailand they actually say Singha.
No, it's not sing.
Okay,
The
well.
Thais say it's sing.
Sing.
And Dr.
Sing.
Jerry, getting back to anxiety and worry,
What happened to them? I tell you.
I don't know. I think they've got anxiety right now about a tree.
I'll buy you I'll buy you
Carton of Sing.
a carton of sing when we go to your
Sing.
house.
You just want to say the word sing.
Sing.
Yeah.
Yes, FD.
Okay, so there are there different types of anxiety, or are there different levels of anxiety?
Let's go with the different types first, because people like to look at the different types of anxiety. So anxiety disorder is a big umbrella, and then underneath it you have generalized anxiety disorder, GAD, social anxiety disorder, which a lot of students love to tell me that they have, but they're just at a very awkward age that they need to learn a little bit more social skills, but they recluse themselves saying that they have social anxiety disorder. Panic disorder comes under the umbrella of anxiety disorders. It is not a separate category. So a lot of people think that panic disorder is a bit more atas, it's a separate category, that it is more severe. No, it is not. It comes under the umbrella of anxiety disorders. Then you have your phobias. So I think we had spoken about phobias before. So phobias come under the umbrella of anxiety disorder. So it's just a few different types of disorders under the broad category.
To
So
me,
the different
I see anxiety disorders, the reaction to anxiety as being more quiet, more subdued, but panic more visual, more loud. The response to a panic.
I guess it's how literature expresses it. It can be very silent. So when someone has a panic attack, they can be very jittery. They feel the pain in their chest. They can keel over. It can be also very silent, but the noise in their head, in their body, is very loud. It's very extreme. It's like, oh my gosh, I'm just wrecked with anxiety and I cannot get out. I feel I'm going to die. I feel I'm going to faint, but they don't actually tell anyone about it.
It's a horrible feeling.
I've had noises in my head before. I've had but I don't, of late, I've not had it. But this was, I don't know, maybe 20 years ago or something, where I felt that it's extremely noisy in my head, like screaming. Swear to God, not.
But were you having alcohol poisoning at that point?
Nothing. It was just like very, very loud. I couldn't tell. There weren't actually voices. People weren't actually saying anything. It was just very, very, very noisy. But I wasn't feeling anxious on the outside. It was just my head that felt like I need to shut the noise out.
Then that's not a panic or anxiety.
But that has
attack.
stopped. I don't know, Dr. Jerry. I don't know what it was. But I
It
have
could be.
felt
There
noise.
There are some clients, some people that actually with panic disorder, describing it the way you've described. I mean, at that point in time, I don't know whether you are having a panic attack or not, but it could be, very high intense emotions that you're feeling, but not manifesting on the outside. So people, when they are looking at you, cannot see that you're going through anything at all. So oftentimes we think that anxiety or panic disorder would be very visual. Remember that mental health conditions, mental health disorders tend to be very invisible. Yeah.
So how do we? So if it's so invisible, like how do we help others who may be going through it, but because you can't see it and because they may not necessarily verbalize it, how do you help?
Right.
You hug them, I think. You hug them. But these
but
days,
that's
you
what-
hug them, you get into
exactly.
trouble.
That's what FD was saying, right?
Exactly.
Because
You
there are
don't know what to
boundaries.
do,
the
right?
boundaries, there are invisible boundaries that you know of.
You can ask them. I mean, they might not be able to come out and tell you, I need a hug. But if you feel inclined, so the thing about hugs is it's not always reciprocal. And sometimes it is from yourself. That means the expectations is from yourself, meaning that you are the one that want to hug. So if you see someone that is a little bit pale or not feeling too good, you might be the one compelled to want to hold the person, hug the person.
Yeah.
Now ask the other person, can I hug you? So it's a can I hug you? Not I think you need a hug. The other person feels, like it's an imposition.
Like,
And
don't
if you're
assume that
in-
I need a hug.
Correct. So if you're in a position of power, they don't know how to reject you. If they're in a weaker state, they feel a little bit weaker. They also don't know how to reject you. So they receive the hug, but they can feel very uncomfortable about it.
I like what you said. If you're in a position of power, we'll talk a little bit about that sort of dynamic when we go on air.
Okay. Stand by.
Possibly then you're over. Look back and watch me smack that hack all on the floor. Smack that hack, give me some more. Smack that hack till you get sore. Smack that hack, oh. Smack that hack all on the floor. Smack that hack, give me some more. Smack that hack till you get sore. Smack that hack, oh.
Kiss 92 traffic.
On the SLE towards the BKE, right after the Lentor Avenue exit, please avoid lane 4 if you're heading down that stretch. An accident has been reported. If you see anything else, the number is 88550920.
Welcome back to The Big Show and The Big Show TV. It's Glenn, Angel, FD, and Dr. Geraldine Tan this morning. Okay, he's looking very, very serious.
Yeah, he didn't forget
I
you.
just want to say that today I tried something different. You see, in my flask today, right? Usually I have my kopi o kosong,
Correct.
that
Yeah.
bag, right? I thought for the longest time that was strong coffee until I decided this morning to make instant coffee. The Nescafe Intense instant coffee.
The gold
That
one.
is intense.
5 teaspoons of coffee with this much water. I feel like I want to bounce off
Are
the
you
walls.
bouncing? I was just about
Yeah,
to say,
'cause
are you
no-
bouncing up the walls?
Nobody uses more than 2 teaspoons
But it's
of
good though. It's a
Nescafe
good feeling.
Intense.
I can go on forever.
Oh.
I can continue to do like the next shift and the shift after, all the way to Trust You on Your Way with Joshua Simon.
Okay, you can stay.
Okay.
We're
All
going to
the
leave
way.
it at
Big-
Anxiety, issues. The
Yeah.
first thing we take away is the caffeine.
Oh,
Yeah.
I don't think Glenn has any anxiety issues.
no.
Dr. Jerry, earlier you were talking not off air, but on the Big Show TV about being in a position of power, because you were talking about if somebody needs a hug, you ask them, do you need a hug or can I give you a hug? Right? But
Yes.
the recipient may feel obliged to say yes because that person asking may be in a position of power. Like, what do you mean by position of power? Do you mean like a parent? Do you mean like a boss? Where would this what would this play out? What kind of dynamic is this?
So if we just use the bigger context, if someone has a role that is perceived as higher, so if you're talking about a boss, if you're talking about a teacher, if you're talking about, someone that is in a position of power, you might, feel obliged to accede to whatever, so that you think is a request from them, right? And you feel you cannot reject. So what we want to do is to empower people. Like, if you feel uncomfortable, it's okay. So when you ask, can I give you a hug? So the other person can say, no, I don't want the hug. It's okay. You can keep it. No. We don't tell them you can keep it. But sometimes how we phrase it is, I think you need a hug. So we impose that onto the other person.
Yeah,
so
being
we
presumptuous.
would not want to do that. Yeah, we don't want to do that.
That's so
because
weird,
they are
though.
already. Sorry?
But there are some people like that. They're like, oh, I think you need this.
Yeah, which is
you
why
should do this.
I feel like it's so weird. It's so weird for someone to go up to another person and go, I think you need a hug.
No, not just randomly. Obviously, you're talking, you're having a conversation, this and that, and then you're like, I think you need a hug. But that I get what Dr. Jerry is saying. You don't presume
Yeah.
or assume that that person needs a hug. If they need a hug, they should say they need a hug.
Yeah, and guy or girl, I've done this because sometimes you just turn to them and go, "Yeah, I really think this is hug time," and
The
Ooh,
person's
you've said
like,
that before.
yeah, and I have never
Yee.
thought. No, and I've never thought. No, because we're
What do you
talking
mean,
about
yee?
personal stuff and their worries and problems at home and whatever. And I've never thought that maybe that person doesn't
Doesn't want
doesn't
a hug.
want the hug.
Yeah,
Yeah.
but even saying that.
No, but the
hey,
narrative, it's changing the narrative, right?
Yeah.
what
Do
time
you
is it?
Yes.
It's hug time.
No, that's because of the way you think.
Yes.
Okay.
Not everybody
exactly.
thinks
Yeah, not
that
everyone
way.
thinks like you.
It's a bit creepy.
Yeah, because you
Only
think
to you.
that way. Yes.
Yeah.
Okay.
Okay.
No, especially when someone is jittery or someone is sad, so we don't know whether they want to be touched or not.
Most of the time, they
Because
don't want to be
everyone-
touched.
Yeah, exactly.
I practice this on my dog, no? Because he's got storm phobia, you see. So sometimes he's like, oh, he's shivering and all that. And I'm like, okay, come, let Papa hug you right now, So then I go down and I want to pick him up, he runs away. I'm like, okay, you go to that corner and go and suffer and shiver yourself.
Oh.
And then when I'm on the sofa, he slowly
Really
comes
comes
back and I'm like, come over here. And then he
comes
jumps
and
up.
hugs.
So you see, it's like,
It's when he's ready.
yeah,
Yeah,
when
it's when
he's
they're
ready.
ready.
When he's
It's like,
ready.
if I want to pick him up, no.
No.
So you know what? The hug time thing, no, bro.
Yeah, no, that's what
Well,
FD is
this
saying.
is exactly what I'm saying.
He's
Helen.
learning
When-
it now.
when
Yeah,
you
but just
don't-
saying it, for example, you know what time is it? It's hug time.
No, it's not
He
what I
didn't
said.
say it like that.
I didn't
No, he
say
didn't say
that.
it. He-
Not in
no,
that
no.
tone.
Yeah, exactly.
I am not a creep.
Let's find out more about FD's creepy moves on the Big Show TV.
Yes, I've got a question for Dr. Jerry coming up.
Okay. Up next, AJ Mitchell with Foolish on Kiss 92.
Okay, Dr. Jerry, I give you an instance. There's someone I know. I'm just
Asking
making
for a
this up.
friend.
No, I'm making this up as I go along.
This
Yeah, I'm making this up. It's
Sure
not
you are.
true. Who I think is possibly going through either anxiety or depression. But every time I try to reach in,
Hug them.
no, I'm not even talking physical. Every time I try to reach in and help, this happy front
Oh, yeah.
goes up and there's nothing wrong and no, don't worry, I'm fine.
Everything's fine.
Everything's a bed of roses.
Every time someone says they're fine, they're not. This
How
is
do
coming
you-
from a woman. No,
How
I'm
do
telling
you handle that? You know the person needs help.
Yeah, that's it's a coping strategy for them, and it's also probably for many of them is they have shared it probably with certain people, and the space became unsafe when they shared it, or it wasn't contained. So it then becomes easier that when they show you a front that everything is okay, let's get on with life. So what they're probably at at a level. So if there are 4 levels, they're probably at a level 2 where it is disturbing, but they still can function, and they are like, okay, let me function. I don't need your help. I don't want to go to a therapist. I don't want to make a mountain out of a molehill. So I'm just going to carry on with my life. Don't disturb me because you're going to break the dam. And when you break the dam, I don't know how to fix it. And neither do you. So don't do that. So it's probably that message that is coming across. Rather than trying to hide, right? Because if it is a good friend, they are not deliberately trying to hide it from you, neither are they dismissing your help. But they are also saying, I don't know what to do, you also don't know what to do, so let's continue with life first
So these
until we can figure out.
So these are people who don't believe in therapists, though. Because, I believe in therapists. I believe in Dr. Geraldine Tan.
Right.
It's just that she doesn't want to see me anymore.
Yeah.
So I have to see somebody else at her clinic.
But you,
Okay, but she has wonderful therapists. I love all of her therapists, right?
you see how he weaves
But-
it in. Right?
Yeah,
Yeah,
but it's true.
yeah.
But you talk about 4 levels and all that. I'm the kind, right? Well, at level 1 already, if I feel something, I will go and see a therapist because I believe in a therapist.
Right.
I think more people should believe in therapists. So that friend of yours, right, is not
Should-
really helping himself or
Or
herself.
herself. Yeah,
You know what I
exactly.
mean?
He says it's a hypothetical, but I don't believe
No,
it
no,
is.
no. I understand where you're going.
Yeah.
But
Hypothetical
I
or
just
not.
I just want to say on that thread that you were just talking about, on the topic that you were talking about, every time someone says they're fine, they're actually not. Because if they're fine, they'll actually tell you, no, I'm really okay. But if somebody actually like if you ask them, they're
Yeah.
like, no, I'm fine. Nobody actually says I'm fine.
But this one is a bit
with
off,
being
lah.
fine. No,
No,
I
I mean
don't
that's some people who say,
know.
"Yeah, I'm fine."
nobody
It's just,
says I'm fine because when you
I'm
say
good. So you're trying to say if a person says
Okay,
I'm good,
so-
it's
so-
different from
no.
I'm fine.
Absolutely. So I mean,
Wow.
Dr. Jerry, just to hear me out, right? Like if I had some issues and say Glenn or FD came up to me and I don't want to share, I'd be like, I'm fine. But if I didn't have any issues, I'd be like, no, I'm really okay. You can tell from the person's tone and the language whether there is actually something going on inside. Is that true or not?
It really depends. Okay. So I would say someone that goes, "You crazy, I'm okay. Why you keep asking me?" And then this person's got it, right? But when someone's, if you are asking that person and the person goes, "I'm fine," we know that things are not fine because things always go on, right?
Yeah.
Life is such. There's always one thing or the other. But if you're saying that there is something more serious than that, it's probably an intuition that you have rather than that person, because the person probably is saying, "I've got it. I don't want to talk about it. Maybe we don't want to dwell on it today. Today is not my time. Why are you giving me airtime?" So they might not want to go into that.
I don't wanna talk about it. How you broke my.
I do want to
But it's
ask one.
on
One.
that-
Sorry, Jerry. Go ahead.
No, just a little bit more on what Angel is saying, because it is true when someone is clearly not doing well and they laugh about it. The louder they laugh, the louder they kind of talk. The more they just giggle and give that big laughter, they are hiding something behind that facade. Yeah.
This is why they say so many comedians are actually the
I was
saddest
saddest
people in the world.
I was gonna say, yeah.
Yes.
Jerry, I do
Yes.
want to ask this. Panic attacks, anxiety attacks, do they lead to other things? Comorbidities.
lead-
Comorbidities.
Okay. So if you're looking at anxiety, right? Anxiety disorder, we do see that with other disorders also. So you mentioned about depression. So they come quite hand in hand with anxiety. Obsessive compulsive disorder, OCD. So they are very anxious. Some of the personality disorders also display very high anxiety. Yeah, so you have your schizophrenias, your psychotic, psychosis. They do get paranoia also. So it does come with anxiety. So the other clinical disorders can also have anxiety come hand in hand. Earlier, Glenn mentioned about substance-induced anxiety. So that's another area that it is also possible. Yeah, I think he was talking about like
don't remember that.
alcohol.
Alcohol and stuff like
right,
that.
okay.
Yeah.
Yeah.
Was it last week or what? I was
Yeah.
talking about this.
I don't remember him saying it now.
Yes.
Really? I don't remember
Yeah.
I
that.
also
So what we're saying is excessive amounts of alcohol, excessive amounts of, excuse me saying this, opioids and things like that can lead to anxiety
Can
attacks and
lead
panic
to-
attacks?
Yes. So you see them being very jittery, short of breath. It mimics all the signs and symptoms of anxiety.
Because
Yeah,
they're
and they can-
withdrawing from it, or while they're on it.
while they're
Oh,
on
while
it.
they're on it, right? Okay.
While they're on it. So some people, if they drink too much or if they take certain substances, if you drink too much caffeine and you're not just bouncing off the wall, but you put out your hand and it's shaking, your heart is palpitating very, very fast.
That's your 7 spoons of coffee right there.
Okay. So far, so good. If I'm a surgeon, the patient will be okay. Okay, okay, wait, we're going back on air again.
Cause I used to be young. You tell me time has done changed me. That's fine, I've had it going right. I know I used to be crazy. That's cause I used to be young.
Kiss 92 traffic.
If you're heading down the SLE, heading towards the BKE after the Lento Avenue exit, look out. Lane 4, there is an accident vehicle or vehicles taking up some space. If you know anything about that, you can always drop us a WhatsApp, 88550920.
Welcome back to The Big Show and The Big Show TV. It's Therapy Tuesday with Dr. Geraldine Tan from the Therapy Room. And you know what? Over the weekend, FD and myself were working with the good people at Porsche. And the head of marketing there, Magdalene Tan, says she's a big fan of yours. So I'm quite sure Magdalene is tuned in right now.
Oh, so sweet.
Okay, Jerry, we've got a comment on our Facebook page, and I want your response to this. This is from Sue Cheng. We're talking about panic attacks and anxiety. She terms it hurting. Okay? Hurting. Surely if you're hurting, once you begin to air it out, you're on the road to recovery.
Who says
True,
that?
not true.
Xu Cheng says that.
Okay, so I suppose she's talking about the disorder, or she's just talking about the emotions.
Well, but basically, when she says once you start talking about it, you're on the road to recovery.
Because then you admit that you have an issue. Is admission the first step to getting better?
The acknowledgement, yes. So if we acknowledge that we have an issue, so the talking is very different. So if you're talking about a level 1 worry, and you're talking about that, I'm worried about public speaking, my hands get sweaty, I've got a knot in my stomach, and you start to brainstorm. It's definitely far easier than when you're a level 3 or level 4 and it becomes a disorder. That means it becomes debilitating. You cannot take on that presentation at all, and then talking becomes a little bit more clinical. You're looking at working at change in lifestyle, not just strategies anymore. You're looking at where it stems from. You're going a little bit deeper. So yes, it is essential, I suppose, to talk about it, but the talk at different levels can be quite different. But people tend to assume that my level 1 and level 3 talk is the same. No, it's not the same. So they go in at a level 3 saying, just tell me what to do. Just give me the strategies to manage, the presentation, for example. But it doesn't work that way when you're already at that level where you cannot function.
So flat out, Jerry, panic attacks, anxiety attacks, can people be cured from it?
They can manage it very well. Yeah, so they definitely can. Can they manage to a point of a level 1? Yes, they can. So they don't need to suffer. They don't need to feel paralyzed with fear. So the word paralyzed with fear, right? They don't need to encounter that sort of situations anymore.
Can they manage it to a level 0, like completely be cured from it?
Can they? I would say so. I'm always very cautious because it is in our emotional toolbox. So I do not want to numb. I don't want them to assume that they will never ever feel anxiety or they will never ever feel anxious anymore. That's not true.
Because it's
But will
nature,
they
it's human
feel-
nature to feel it.
Correct. So I don't think if they assume that they are never going to feel it anymore, no, they will feel it.
Yeah.
but they will know how to deal with it, and it is. They recognize that it is temporary and not pervasive.
Yeah.
Okay.
I mean, everything requires management, right?
Yeah,
Because
for
it's
sure,
an emotion as well, so it's impossible
To not feel it.
to not feel like panic or anxious.
Like
from
Dr.
time
Jerry
to time.
said,
Yeah.
otherwise you'd be numb, right?
Yeah, or anger, for example. I mean, we're all
Yeah.
capable of being really angry and
course.
losing our temper, but we manage it.
Yeah,
Yeah,
of
yeah.
course.
Right,
yeah.
Jerry?
Yeah.
Maybe I should have been a psychologist instead of a
Maybe,
DJ.
yeah. You would have earned a lot
I would
more
have been I would have been almost as good as Jerry. Almost.
Almost.
Because she is fantastic.
Award winning. Yeah.
Exactly.
He's
Anyone
still
who
not
has
getting this on the couch.
No,
Still no, huh?
he's
Okay.
trying. Yeah, he's trying. It's a good try though.
Okay.
Very good try.
All right. But anybody has any issues or whatever, if you don't know which therapist to go to, go and look for Dr. Jerry at the therapy room. All right. She's award winning and she's got fantastic therapists who work with her as well.
You know, I just realized our 4 squares on the screen looks like the Muppet Show. You know, remember with the Muppet Show, they all had these squares and we could
Yeah.
point up and point down.
You see, Jerry, it's the simple things in life that keep us entertained.
I know, but that's why all of you are such a joy to be with.
Aww, likewise.
Still not
Likewise,
getting on the couch.
Back
yeah, okay.
at ya. Okay, Jerry, we've got to go because the newsreaders are,
And they're waiting. In the
yeah,
wings,
they're waiting. They're waiting to present the news. So, any last words?
Okay, so in any case, the tips would be taste, temperature, color, smell, and let me see, we have texture. But any questions, we will take it the next time. A little quote from, I'll try to pronounce this person's name, Kahil Gibran.
Gibran,
And
Khalil
he said-
Gibran, yeah.
Gibran?
Yeah.
Our anxiety does not come from thinking about the future, but from wanting to control it.
I love Khalil Gibran.
So just let go. Just let go. Huh? Yeah, in life,
Yeah.
let go. Just go with the flow sometimes.
I think, okay.
That's the best.
Yeah, sometimes.
Yeah,
okay.
sometimes.
Not
Just
sure
I mean,
that-
just taking advice from Gibran.
Khalil Gibran.
Gibran.
Yeah. Okay. Thank you very much, Jerry, for joining us once again.
See you next week.
I'll see
Thank
you this
you.
afternoon on your couch. No.
No, Glenn, no.
Shucks.
Bye.
Bye,
Jerry.
Stand by. Headline news and sports up next.
The Big Show. Kiss 92.
Thanks to Harvey Norman. Final days to get scratch cards of over $100,000 worth of cash.